And so this next segment is kind of playing off the segment we did about Kylie Jenner and how she admitted she had breast augmentation, because one of the things that she said was that she regretted having a breast augmentation before she had kids, and she wished she had waited. And so there's Kylie up there, a picture of her. So I think that's a good thing to talk about, and it's something when patients come into my office that are younger, I always inquire about, okay, you know, have you had kids? Are you planning to have kids? Because it does kind of weigh into the idea of having plastic surgery. And so I'd like to just kind of like talk about some of those plastic surgeries that you may or may not consider waiting on.
Yeah.
And so the one that Kylie did, she had a breast augmentation. And so, you know, I would say that the bulk of people I do plastic surgery on are moms who are kind of done having kids. You know, you kind of get this idea it's all like 20-year-olds having plastic surgery, which is not reality, at least around here.
I'm not one of those.
You're not one of those people?
No, I got mine before I had my daughter.
Oh, you did? Mm-hmm. Okay, well, I wasn't going to ask you, but if you're going to volunteer.
Yeah.
So you did it beforehand? Yeah. And so,
but people think mine look more natural, though.
Did you have any regrets of doing that before or not?
Well, I was able to breastfeed too.
Right, and you should be able to.
Yeah.
There is so that's one of the concerns when you're talking about breast surgery and before kids. There is a few percent risk per side of not being able to breastfeed.
Yeah.
And that depends on exactly what you're doing, but it's a small risk.
But I didn't have any
problems
issues with it.
Okay, no. That's great, and that's good. You know, yet I don't want to say that you're lucky, but I mean, it could have been a different outcome.
Yeah,
for sure. Because one of the concerns about doing a breast augmentation before kids, as we said, the breastfeeding thing is one. But the fact that you're stretching out your breast with an implant, and then on top of that, you get pregnant and then your breast enlarge, you know, for nursing, it can cause enough change to your breast tissues and the skin on your breast that your breast might end up being saggy if you did the aug before, but if you hadn't done the aug, your breast didn't get stressed out enough and then they return to normal. And so what that boils down to is that, you know, if you do a breast augmentation before kids, a couple things might happen. One, you may have to have another surgery after that to fix things, whether it be to adjust the size, because sometimes your breasts change after nursing and pregnancy. They end up being, you know, bigger or smaller, and it may not end up being the size that you want. Or the other thing is that you may end up get sagging of your breasts. And so you'd have to have a lift, which is fine. I mean, you can do a lift, but it does end up putting some scars on your breast that you may not had to have had if you had waited to do the breast augmentation until after kids. But of course, like everything, there's like pros and cons, right? I mean, you know, being just purely blunt and honest, I mean, there's a lot of girls that want to do something to you know, change themselves before they get married, you know, while they're still dating.
Yeah.
You know, it's like, you know, I used to work out a ton before I got married, and I still work out a little bit because I try to stay in shape. But man, I was hitting the gym hard. Man, I need to look good when I was out there, you know, trying to meet people, right? Yeah. I mean, it's a competition, isn't it? And so, but I do have these conversations with people when they come in, specifically for breast augmentation, you know, about you do realize that, you know, when you have kids that things might change. Yeah. And so, and I think most people realize that, or, you know, they hear it, they're like, okay, that makes sense. And, you know, I don't think it changes people's minds a whole lot, you know, because I've never talked to somebody and they say, oh, I didn't think about that. See ya.
Yeah, it didn't change my mind.
Yeah, it didn't change. Did they? So when you went to your consult, if you remember, did they talk to you about the fact?
Yeah, he specifically asked me if I wanted to.
Really? Okay, good. Well, that
like breastfeed and all that kind of stuff.
Yeah.
And
that's great. Okay, sounds like your surgeon really was kind of on top of it.
Yeah.
So the other surgeries that you might consider waiting would be like a breast lift.
Yeah.
It's the same reasons. I mean, you're going to do the surgery to make your breast look the way you want, and then pregnancy may change that. And so, you know, that's, I mean, another one that's on the fence, right? Because, you know, if your breasts naturally just have a lot of sag just from genetics, you might feel very self-conscious about them. And I've done lifts on people that haven't had kids before. I mean, most of the people you do lifts on, you're doing them because of pregnancy.
Yeah.
But there are people that just genetically have sagging of their breasts. And so I've done some lifts on people before, and I'm like, look, just be aware that pregnancy may change it. Breast reduction would be the other one. I always kind of lump breast reduction and breast lift together because they're almost identical surgeries, except for the reduction, you take a little tissue out versus a lift, you don't. But otherwise, they're identical. Liposuction is another surgery where it's like, okay, do you want to get your body all contoured the way that you want, and then pregnancy change that? And so, I'm a little less, aggressive about not talking people out of it, but if somebody came in, they want liposuction before they could, I'd say just be aware that when you get pregnant, things may change.
Yeah.
I'm
for sure. That's definitely one that I would wait for.
Would you? See, for me, like the breast stuff's worth almost waiting for, just because it might add a whole nother surgery, versus the lipo. It's like,
As if I went to, I don't think I would go to get like another boob job or anything.
You probably will at some point in your life.
Right now, I'm saying. I'm not married, and I'm and I want to have another kid, but I'm not going to go do that right now just because I'm single and looking, but as a 20-year-old, I was not thinking about kids. I was like, I just want to look cute.
Right.
So
I feel so old sometimes when I'm talking to younger people. I'm like, oh, you got to think about when you get older. And if someone had told me that when I was young, I'd be like, who are you?
Yeah, as a 20-year-old, I was just like, I just want to look cute in this swimsuit or this top.
Yeah, exactly.
Yeah.
So the one though that probably is the big one would be tummy tucks.
Yeah, that's
you absolutely do not want to have a tummy tuck before you're done having kids. And so I do tons of tummy tucks. I do probably one a week, and that is something I always ask patients about, like, are you done having kids? And if they say no, I guess maybe I would do the surgery for them, but I would have to counsel them that, look, pregnancy is going to take everything we did and just flush it down the toilet, because things like stretchy skin, tight abdominal wall, all of that gets altered with pregnancy.
Literally flushed down the toilet, thousands of dollars. Yeah.
Right, exactly. And plus, and those surgeries get harder when you try to redo them, especially tummy tucks. I've done redo tummy tucks, not on my own patients, but on people who had them done elsewhere. They're not fun, and the recovery's not fun. That's a bigger surgery. It's a little bit more rough recovery than breast surgery. You really just want to do that one time.
Yeah.
So I think that's an important one that,
one of my sisters wants to do that. She's in this process of losing a bunch of weight.
Oh, is she?
She's taking
she's
taking one of those shots.
Ozempic? Yeah.
But she got it prescribed for real reasons, not just to lose weight, but
for diabetes or something? Oh, okay.
To make it to where she doesn't have diabetes, to get her, because she was right on the line. But she has a goal. She has a goal of weight loss, and when she hits that goal, she wants to do a mommy makeover. Yeah, she's already lost 30 pounds.
Nice. That's
yeah.
Great. Excellent. Good for her. But yeah, definitely would want to wait until weight stabilized for that. That's a whole other conversation about when people are losing weight.
She's
and
she's probably not going to do it for a year or two.
Yeah, you definitely want your weight to be stable. So, but it's an interesting conversation about when to have plastic surgery. At the end of the day, as long as it's safe, I don't have a problem doing plastic surgery on people that have kids. Obviously, but you just do have to consider what the outcome of that would be, and is that decision going to mean that you're going to have an extra surgery down the road? You just want to be aware of that, and so if you're thinking about it and you haven't had kids, just make sure that when you go in and talk to the surgeon, that they kind of give you the information about what does this mean after I get pregnant.
Yeah.
So, because
I agree.
There are people out there, that would maybe not even mention that. Just be like, oh yeah, you want this? Let's
money.
go do it. Yeah, money, right? Yeah, money. So, but no, it's a good conversation to have. So, all right. Well, leave me a comment if you have questions about plastic surgeries before and after kids. I'd love to hear from you.